Okay, welcome back everyone. And our next talk is by Sanna Moilanen. She will speak about work-family conflict and parenting confidence.
Hello, everyone. My name is Sanna Moilanen, and I'm currently working as a university teacher in the University of Jyväskylä. And I'd like to thank you for the opportunity for me to speak and tell you, speak in this seminar. And I'm so excited to share some of the main findings from my recently completed postdoctoral project called One Child. In my project, I focused on Finnish first-time parents and examined how the transition to parenthood and early parenting experiences influence their decision to have a second child. And today we will focus on how first-time Finnish parents navigate early parenthood and how dynamics in work-family conflict and parenting confidence shape their intentions to have a second child. My research addresses the ongoing decline in fertility that we have observed in Finland and across numerous countries globally. So I'd like to start off with saying a few words about the recent fertility development in Finland. And here on the slide, you can see a figure illustrating the development in the total fertility rates across the Nordic countries between 2010 and 2024. And as we can see, the trend is negative. The fertility has been declining more or less in all of the Nordic countries, and Finland is highlighted with blue in the figure. And since 2015, Finland has consistently reported the lowest fertility rates among the Nordic countries. And the number one reason for the decline in Finland is the drop in first births. So this means that more and more adults are not having children at all. However, demographic research in Finland has established that around 21% of the recent decline results from a decrease in second and third births. So a significant amount of those who are already parents are not having another child. So this raises an important question of what factors potentially influence first-time parents' decisions about whether to have a second child. And this is the question my project aims to answer. And I approach the question through family research. The more specific questions of my project are how becoming a parent and parenting a young child and balancing work and family life shape the decision to have another baby. And as I mentioned, I focus on Finnish parents, both individual parents as well as parental couples in my project. And today we will focus on two specific themes that are part of my project, and we will look at how work-family conflict and parenting confidence in early parenthood shapes first-time parents' decisions to have another child. Let us begin with work-family conflict. So in our study, we were interested in how does the experience of work-family conflict change during the transition to parenthood? And do these changes affect whether mothers and fathers plan to have a second child? And these findings come from a study that was recently published by me and my colleagues, which you can see here on the slide. So generally speaking, work-family conflict refers to parents finding it difficult to manage both work and parenting responsibilities at the same time. So when a parent experiences conflict, it can feel like being pulled in two directions at once without enough time or energy to do both well. In our study, we approached the parents' experiences of work-family conflict from a broader perspective. So first, we know from previous research that work-family conflict is bidirectional. This means that work life can affect family life and vice versa. Work-to-family conflict appears when parents find that work responsibilities make it harder to spend time with family or be the kind of parent one wants to be. Whereas family to work conflict, again, stems from family responsibilities, making it harder to focus on work or do one's job well. In addition to these two directions, we examined two different types of conflict, time-based and strain-based conflict. A parent experiencing time-based work-to-family conflict might consider that my work keeps me from my family more than I would like. Another parent perceiving strain-based conflict from family to work again might think that because I am often stressed from family responsibilities, I have a hard time concentrating on my work. So we investigated 4 different types of conflict and their changes during the transition to parenthood. In our study, we utilized the longitudinal survey data collected as part of COBA Global project. And specifically in this study, we used data from first and third waves. So first, we asked the parents to estimate their work-family experiences when they were expecting their first child. And we asked the same parents to estimate their work-family experiences again when the firstborn child was about 1.5 years old. And during the latter time point, we also inquired about the parents' plans to have another child during the following 3 years. And in our data, we had 269 Finnish first-time parents who were living in 2-parent families. And next, let us move on to the interesting part, so the results. Here we have 4 figures illustrating the changes in the 4 types of work-family conflicts. And on each of these figures, we can see the average level of a certain type of conflict, first prepartum, so during pregnancy, and 18 months postpartum, so 18 months after birth, for both mothers and fathers. If we start from the left-hand side, we first observed that time-based work-to-family conflict increased significantly over time for both mothers and fathers. This indicates that the parents saw that the time demands originating from work made it more difficult to engage in family responsibilities after the birth than when they were expecting their first child. And moving on to the lower figure, to strain-based work-to-family conflict, our results show that this type of conflict did not change significantly for fathers over time, and surprisingly, this type of conflict decreased for mothers over time. This means for mothers that they perceived that stress originating from work role made it less difficult to engage in family activities after birth compared to when they were expecting their first child. This decrease can probably be explained by that some mothers tend to make temporary adjustments to their working times and the contents of their work after having a child. So these temporary adjustments may explain the decrease in this type of conflict for mothers. If we move on to the right-hand side of the slide, our results show that both time-based and strain-based family-to-work conflict increased during the transition to parenthood significantly for both mothers and fathers. These results suggest that parents perceived that both time demands and stress originating from the family role made it more difficult to focus on work after the birth than when they were expecting their child. Both of these results were expected, as parents need to devote more time and energy on childcare and housework after having a child, which can be seen to hamper their work engagement and work performance. So in conclusion, our findings indicated that the work-family conflict predominantly intensifies after becoming a parent. Next, we were interested whether the changes in the 4 types of conflicts influenced parents' intentions about having a second child. Only one type of conflict was significant, and our findings were somewhat surprising for mothers, as we discovered that mothers who experienced a stronger increase in strain-based family-to-work conflict over time reported a more positive intention to have a second child. This finding suggests that first-time mothers who are facing rising family-to-work conflict are encouraged to plan for a second child. This unexpected finding can possibly be explained by the relatively comprehensive family policies in Finland, in that mothers with high conflict may consider having another child and the long family leave as a welcome pause from the intensity of work and family life. However, it is also possible that these mothers value family life and have decided from early on to have more than one child. So even an intensification of conflict over time does not prevent them from intending to have another child. Our results for fathers again indicated that changes in any type of conflict did not influence their intentions to have another child. But we definitely need more research in the future to confirm our findings and find explanations, especially to our unexpected findings. Next, let's move on to our second study in which we focused on parenting confidence. So in this study, we investigated how does the experience of parenting confidence change in early parenthood, and specifically from 6 to 18 months after birth. And in this study, we focused on first-time parental couple members instead of individual parents. We were also interested in whether the changes in parenting confidence influence whether parents or their partners plan to have another child. This study has not been published yet, but the manuscript is in preparation and co-written with the colleagues you can see here on the slide. So the findings are initial at this point. Now, you may wonder what is meant by parenting confidence. In our study, it refers to self-assurance that parents perceive about their ability to successfully parent and care for their child. In more simple terms, it's about how confident parents feel in handling everyday parenting tasks like calming their child, setting routines, helping them sleep, playing together, or caring for the child when they're sick. And in our study, both mothers and fathers assessed their parenting confidence with 8 items. 2 of these items you can see here on the slide. The parents assessed, for instance, how often they felt that they can soothe their child when the child is distressed, or how often they felt they can make decisions about the care of their child. So with these types of items, we were able to estimate the level of the participating parents' parenting confidence. And again, in this study, we used the same COBA-CLOBA data, but now we focused on waves 2 and 3, so the time after birth. We asked the parents to assess their parenting confidence first when the firstborn child was about 6 months old, and again about 1 year later when the child was about 1.5 years old. And again, on the latter time point, the parents assessed their plans about having a second child. As I mentioned before, this study differed from the previous one in that this time we focused on couples. So we have data from both parents in a family. And in our data, we had 134 Finnish first-time parental couples. And let us move on to see how parenting confidence changed between these 2 time points. Here, again, we have a similar figure as before, and our results show that their parenting confidence increased or strengthened for both mothers and fathers over time. This means that parents felt more confident as parents as the child grew from a 6-month-old infant to an 18-month-old toddler. These findings were indeed expected, but what was interesting, however, was that parenting confidence grew faster or more steeply for fathers compared to mothers. And this result can be seen from the figure. And this finding was understandable as mothers tend to be the primary caregivers during the first months after birth, but fathers may become more involved in the care and parenting as the child grows from an infant to a toddler. And in Finland, such paternal involvement is increasingly encouraged by family policies, as we have heard. And this is something that contemporary fathers consider important themselves as well. We further discovered that the changes in parenting confidence over time were not influenced by changes in the partner's confidence. And this suggests that the development of parenting confidence in early parenthood occurs independently within each parent. It is possible that mothers and fathers develop confidence in parenting tasks in their own and possibly different ways. And parents may also allow their partners the space to develop personalized or individualized ways of practicing parenthood and building confidence in parenting tasks at their own pace. Finally, we studied whether the changes in parenting confidence influenced mothers and fathers' intentions to have a second child. And we excitingly discovered that when mothers became more confident as parents over time, both mothers and their partners had more positive intentions about having another child. But interestingly, when fathers became more confident, it didn't really influence how either of the parents felt about having a second child. So it is possible that the central role of the mother in early caregiving explains our findings, why both mothers and fathers perceive that the enhancement in the mother's confidence is particularly important for the couple to consider having a second child. In terms of conclusions and practical implications, our first study indicated that work-family conflict predominantly intensifies or strengthens as individuals become parents in Finland. However, in the Finnish context, this increase appears not to discourage parents from planning to continue childbearing. What our findings imply is that helping parents balance work and family life should be a top priority for policymakers. We know based on previous research that high conflict is associated with more negative parenting practices, and it can also hamper the well-being of both parents and children. So this is why helping and supporting parents is important. At workplaces, it would be important to support new parents, and this can be done, for example, by offering flexible schedules, more control over work tasks, and the option to work few hours, for example. But social support also plays a key role, as we know that it is known social support is known to help families manage both work and home responsibilities. However, as we heard, in Finland, regular help from informal networks, for example, grandparents, is not that common for every parent. So this is why families could benefit from more support at the societal level. For example, practical help at home or childcare outside regular early childhood education and care hours could make a big difference for parents and families and their well-being. Continuing with the second study, we found that parenting confidence indeed strengthened from infancy to toddlerhood for both mothers and fathers, and particularly sharply for fathers. And the findings highlighted that when first-time mothers' confidence in parenting strengthens particularly effectively during the first 18 months of a child's life, both mothers and their partners are encouraged to continue childbearing. Our findings offer valuable insights for professionals working in family services, for example, especially those who supporting new parents. It would be important that these professionals are able to identify parents and particularly mothers of infants who may be finding certain aspects of early parenthood as challenging. And by recognizing these struggles, the professionals could offer support that helps parents build parenting confidence where it is needed. We also know that spousal support, both emotional and practical, plays a key role in developing parenting confidence. So it would be important to develop concrete ways to strengthen the support between partners. For example, through discussions and resources offered in family services. Ultimately, helping parents feel confident in their parenting and supporting them in balancing family life with other areas of life is essential, not just for their well-being, but also for their children's well-being and potentially for family and childbearing decisions as well. I thank you for your attendance, and if you have any questions, I'm happy to answer them.
Thank you so much, Dr. Sanna Moilanen, for this interesting talk.
Thank you.
Thank you, Sanna. I was thinking that related to social support and related to appraisal support, which is important for the self-esteem. So it might be also very important for the parental confidence and therefore also for the perhaps the second child intention. What do you think?
Yeah, previous research shows the importance of social support and spousal support for continuing childbearing. And actually, in terms of parenting confidence, there are some studies. Parenting confidence is really close to parenting self-efficacy, and there are studies that have focused on the development of fathers' parenting self-efficacy during the transition to parenthood. And in these studies, it has been found, for example, that the co-parenting relationship is important in terms of the development of parenting confidence for fathers. So yes, it is indeed important part of developing one's confidence in parenting.
And I was also thinking that in Finland, we did not find very much mentionings about that kind of appraisal. That other people tell you that you're a good mother, you do good work. So this is, I think it's important.
It is indeed. And because in Finland, for example, the dominant ideology tends to be the intensive mothering ideology, which places quite high demands, especially on mothers. And because new mothers are inexperienced, I think they are particularly vulnerable to the effects that the external effects, for example, the parenting expectations placed on mothers. So they can make, in the worst case scenario, the high demands can contribute to mothers feeling insecure about their roles as mothers, and this can decelerate the development of parenting confidence for mothers. So yeah, this is an important point.
I would like to continue with that with one question. Could that actually, or what do we know about the reasons behind the father's more rapidly increased confidence in parenthood?
Yeah, from our
mothers?
data, we could not find out what is the actual reason, but I think it may have to do with increasing paternal involvement as the child turns from an infant to a toddler, as the maternal responsibility subsides a bit and the father takes a more active role, so he can start developing and strengthening his confidence in parenting. And also, as I mentioned, the normative expectations towards mothers that are more demanding compared to fathers. So this can also decelerate mothers, the development in mothers' parenting confidence. So this may be the reason for why the father's parenting confidence grew faster than that of mothers.
Thank you. Very important questions.
Thank you.
Aspects, yeah. Thank you so much. And now I think we need to continue to our last lecture, which is by Marisa Matias. And now we move to Portugal. And Marisa will talk about the parenting support and intentions for second child in Portugal. So the Zoom is yours.
Thank you. I guess I'm already sharing the presentation, so you're already seeing my slides.
Yes, we see.
I would like to start by saying thank you for inviting us to be here. It's really a pleasure to be part of this webinar, and it's been a pleasure to work with this team under this project. So good afternoon, good evening, good morning. And I'm going to give this talk about following what Sanna was just telling you about the intentions for a second child, using data from Portugal and using also some of the interview data to shed some light on this issue. The work I'm going to spend some minutes talking about today was the subject of one of my students' master thesis, Jessica. And so it's already submitted also for a journal. And we are going to try to understand specifically what Anna was just asking. what can be the role of parenting support in these intentions for a second child. During the day today, we already heard a little bit about the context and the cultural context of the Copa Global study and of the different countries. But I would like to stress some specificities of the Portuguese context, namely for the attendees that may not be so familiar with some of our contextual aspects in Portugal. So Portugal is one of the countries with the lowest fertility rates in Europe, and therefore the decisions to become a parent for the second time is particularly meaningful. We have been having a slight fertility and population growth in the last couple of years, and this has been mainly due to migration, which is also increasing in our country. But as people tend to have fewer children, of course, these decisions becomes crucial, not just from the point of view of the family, but also from the societal point of view. We draw for this work on two major conceptual perspectives. So one of them was Bronfenbrenner's ecological model of human development, mainly because it reminds us how individual actions and choices are nested within multiple social systems, family, work, community, and also polity contexts. And so we wanted also to bring into dialogue these multiple contexts and how they can be shaping parenting intentions. Another important conceptual background that we brought to the study was the family systems theory. And according to this theory, it emphasizes how families reorganize through interaction and change. So we assume, of course, that couples influence each other through negotiation, through shared experiences, and through mutual adjustments. So in this view, we wanted to understand this interplay between several factors. I think it's more or less clear, since this is the last presentation of this webinar before the panel, that social context indeed matters, and the availability of public policies, financial stability, but very importantly, social support networks and the type of support that can be provided to families and to couples is indeed very relevant. And so in this study, we wanted to get deeper to this type of networks and to the different types of support that these families have available. And just as Chino was mentioning early in the morning, we can differentiate instrumental support, informational support, emotional support. And this was what we also tried to do with this study. So what some of the gaps in past research were or are, especially that they don't focus so much on individual or at least on how couples jointly make these decisions. So we have some studies focusing mostly on structural levels, policy level factors, and some other studies focusing on individual level factors. And so we wanted to bring the couples to the front and also understand how they are interacting to make this decision. So two major research questions guided our study. So first, the kinds of supports that these parents received during their first parenting experience, how do they assess it? And the second question was, what roles do these different types of support played in the couple's intentions to have a second child? Our study design was mixed methods, in the sense that we used a question from the survey data and then the semi-structured interviews. So we used the data from the follow-up interviews, so when the child was around 18 months, and we used also the survey data at the same time. We, as you know, had data from both partners. So here we addressed both partners' interviews. We used the survey data question that was just mentioned by Sanna as well, we asked in the questionnaire at some point if these parents intended to have more children. And according to their answers, we separated the couples in two groups. So we had some couples saying definitely yes, they want to have a second child. And we had another group of couples who said they definitely don't want to have a second child, or they're likely not going to have a second child. So we divided these two groups, and from these two groups, we randomly selected 5 couples from each, and then we analyzed the interviews from both members of the couple in the total of 20 interviews. Just a very brief description of these two groups. So group 1, the ones that do not want to have another child, they are older, tendency older than the couples who say they want to have more children. But in terms of education and in terms of employment situation, they are very much similar. It's also relevant to say that all participants are in heterosexual relationships with quite stable relationships, and the majority is married. So after we divided these two couples, we looked into the interview data. So we went to the interviews to understand what these parents talk about in terms of support. And to do that, we used as a methodological approach a thematic analysis. So we were searching for the topics, for the themes, both first at the individual level, but then at the couple level. Moving to our results, which I believe is the best part of this kind of works. We organized our findings and the topics of the interviews in 3 major sources of support. So we have support stemming from the parental system, from the social networks, and the formal networks. In each of these types of support, there are different nuances, different aspects that I will now detail a little bit further, disaggregating what was common between the two groups, the intenders and the non-intenders, and what was different between the two groups. So regarding parental support, what was common is that across both groups, mothers tended to describe heavier workloads. As one mother said, and here you have the quotes, one mother was saying, "I think it's harder to be a mom because a mom always has tasks that a dad doesn't have." And this is followed by fathers. Fathers often also recognize this imbalance, saying things like, "Usually it's the mother who needs more help than I do because she does much more than I do." So there's this common understanding that this transition to parenthood is especially loading or overloading mothers. Another important aspect in both groups was that family life seems to be the one that needs to be adapted to professional demands and not vice versa. So this idea that the family has to make the accommodation so that the work is not limited or is not impaired. Now about the differences, we observed some differences between the two groups. The group that doesn't want to have more children reported lower satisfaction, with mothers perceiving less support from fathers. So their co-parenting experience was described as a demanding adaptation process characterized by less feedback. Often this feedback was perceived as being negative and being critical. In contrast, mothers in group 2, so the group that wants to have more children, they report higher satisfaction. They report that their relationship is based on collaboration, trust, and good communication. As this father says, "That's why I think we work well as a team." In terms of the support and the communication, this is a very striking issue. The group that plans to have more children also highlights this aspect, saying we communicate a lot, we give all kinds of feedback. Now, regarding the social network support, what is common across the two groups is that in both groups, they don't see a lot of external pressures or expectations regarding co-parenting. So they generally demonstrate an ability to be able to integrate the feedback around them positively. So in both groups, we have comments like, I didn't really feel pressure. I always try to do things as well as possible in my own way, respecting my timing, my limits, and everything. We never heard that pressure that they have to do this or they have to do that. So this was common for both groups. What was a little bit different was the availability of the support network, which varied quite greatly. So families that don't want to have more children, they tend to feel more isolated. They have smaller, less diversified support in parenting. And some of this support is absent because of being geographically distant. As one father says, my mother doesn't support us because she can't. She lived more than 300 kilometers away. So there's this lack of instrumental support, which leads to overload, fatigue, and seems to be somehow impacting their intentions to have a second child. On the other hand, the group that plans to have more children, they talk about a larger, more accessible, more helpful networks from the family, which is quite expected in our cultural context, but also from friends and from other persons that are nearby. So this group also discusses about flexibility in this social support. They find not just instrumental support, but also advice and emotional support around them being available. It was also very interesting to highlight in this social network support topic that there were some reflections about having or not having co-parenting models. And so for the group that doesn't want to have more children, some fathers in particularly reflected that they had no role models for co-parenting. They were in a way experimenting or even inventing a new model of shared parenting. So when they were seeking information, they often turned to online resources, which paradoxically, some of them also said, often leads them to feel more pressure, more guilt, more insecure, and more stressed. On group 2, the group that plans to have more children, when they talk about these co-parenting models, they discuss mainly positive examples in their families that promoted these effective and positive care practices. Now, moving to this last layer of support, when it comes to formal network support, we have here a lot of commonalities again between the two groups. So the parental leaves are now in Portugal, they are mandatory. There are amount of leave which is mandatory also for fathers, and so they take this mandatory time. So they are at some extent shared, but mothers take the longer periods. Overall, they are quite dissatisfied with the current duration of the leaves in both groups. In terms of educational institutions, they are also tend to be also dissatisfied because it's not easy to find a childcare option, and it's not easy to have this availability. There's also some commonalities in the way they speak about professional conditions. So working hours, the commuting distance, they frequently highlight how this hinders their work-family balance. Now, regarding the two groups and the differences, we see that the group that wants to have more children, they are more satisfied with healthcare and with healthcare access to diverse services. The group that doesn't want to have more children, they tend to be dissatisfied with these public healthcare services, and they tend to rely on private healthcare. Also, fathers in this group also discuss about their higher workloads and their less family time. And here, for the group that wants to have more children, they say they are clearly very happy with their public services, and they don't need to go to private pediatricians. And also mothers and fathers' working hours seem to be allowing them more flexibility. So from to summarize, our findings point to several insights. So the persistence of traditional gender roles, as we see, mothers often are still the ones being more burdened. The impact of support accessibility and quality. So this idea that some services seem to be functioning better for the ones who want to have further children, I think it's a very important policy implication that we should consider. Work-family balance also seems to be a critical factor, and so difficulties in balance and the lack of flexibility influences couples' well-being and their decision-making process. And the societal support and the effectiveness of the societal support structures is crucial for their intentions to have further children. Of course, we have some limitations I would just like to highlight. Maybe this will be important for our discussion next. Not just is the fact that we have a sample size which is limited, homogeneous, and at some extent particularly resourceful, because again, we have families with high levels of education, but still we see here the difference that social support may play. And also there's possibly an immigration impact that was not fully explored in these data and can be also relevant for further research. And there's in Portugal also a recent housing problem. Nowadays, affording to have a house is quite difficult for families, for individuals. And so this can also be a limitation from this study and had another layer of difficulties when deciding to have another child. So to my last slide, in terms of recommendations and conclusions from this study, we would highlight the need to work about or on workplace policies, flexible hours, namely, to also strengthen informal and formal support networks, to encourage more gender equity in care providing, and to ensure affordable childcare, also psychological support, and measures to reduce parenting-related stress. Thank you.
Thank you so much, Dr. Marisa Matias, for your interesting talk. And now we again have around 5 minutes before the panel discussion. So if audience members have anything to ask or any comments to Marisa Matias, you can raise your hand or you can write your questions and comments in the chat. Or if you have any questions for previous presenters, but
may I have one question?
Yes.
Thank you, Marisa, for your presentation. I was interested in your finding that these role models, the accessibility of role models, played an important role. How would you elaborate this finding?
Yes, it was very interesting for us to have this finding as well, so that we understand that in the group where they don't intend to have children, they tend to discuss more this idea that the role models that they have, of course, they have some kind of models, but they don't attribute them as being good, effective. So they describe, for instance, that his mother, in this case of the father, he says his mother was not a very good one. Something like she did what she had to do at that time with the knowledge that she had, but they recognize now that this may not be the best way of parenting, and not the best way, or at least not the way they want to do, they want to be parents. And so there's some intergenerational cleavage here of the models that they have and the models they want to follow through. And so I think this is important. If we link this to the fertility intention, it may be that it's somehow a way of not being supported, because support is instrumental, it's practical, it's emotional, but it can also be a support coming from the models that they have or that they don't have. So it was really interesting for us also to understand this difference between the two groups. Yeah.
Now there seems to be a question in the chat.
So how can we do gender equality? And this question is from Japan. So I wonder if our Japanese researchers maybe say something about this or...
Yeah, thank you very much for the question. How can we do gender equality in co-parenting, you mean? So maybe we will talk during the discussion time, a panel discussion, but of course the gender equality connected to the gender norm, and strongly now the political change shows us that our society may shift to the more conservative direction. However, nowadays, the more and more young women started to work as a full-time worker, as other male young workers, so that the work condition and also environment of work is a key issue for equal co-parenting, I think. And also the Daisuke is discussed about this issue during his presentation. So if Daisuke is possible, could you add something if you have an idea?
I believe Marisa talked about in her presentation that 1 month like a mandatory parental leave is now it's legalized. I don't know if it could backfire in Japan or it works well, but I mean, reading the articles or books about parental leave, to some degree, daddy month, a few months just assigned for fathers or mandatory parental leave might work quite well, even in Japan. That's I guess one way to go forward for gender equality, I think.
Yes, very important questions for us all everywhere, indeed. But now it's time to move forward to our panel discussions. So now we have heard perspectives from Finland, Japan, and Portugal, and now researchers from all these countries from COBA project come together to discuss. And they will be discussing how socio-cultural context shapes parental teamwork. So Chino, Yabunaga, Marisa Matias, Marjatta Kekkonen, and Anna Ronka will discuss, and Kaisa Malinen. Kaisa Malinen will be the moderator. So
thank you, Nina. Thank you. Okay, as Nina mentioned, we now have time to reflect the presentations of today with panelists from all the 3 countries. And I will be moderating the discussion and inviting each panelist to join the discussion, but please, at the same time, feel free to comment or continue conversation at any point, even though I wouldn't be directing the question for you. We have 3 themes for the discussion, which panelists have seen beforehand. And let's start with universal aspects in well-functioning co-parenting. And well, we have been working together with these teams for many years. And on the basis of your experiences in COPA project and all the results that we have received, what kind of universal aspects would you or can be found in well-functioning co-parenting? What is shared between the countries? And would Marisa, for example, like to start with this question?
Thank you, Kaisa. Trying to broaden up this idea of the universal aspects of well-functioning co-parenting, I would highlight maybe three aspects that I think we were covering in our last years. And I think one of them has to do with coordination between the caregivers, so between the parents. Coordination in some countries, it may be more based on communication, explicit communication. In some other countries, it may get other nuances, but this coordination, collaboration is highly relevant. I think other aspect that we covered in the project was about the prenatal expectations, and so the preparation for co-parenting. This begins during the pregnancy, and in all countries, the fact that these prenatal expectations are more or less discussed, similar between the couple, this will help then the transition, and this will for sure facilitate the well-functioning of the co-parenting relationship. And I think that today we also highlighted a lot about social support. And so social support is it can strengthen the co-parenting relationship. It can compensate when it's not functioning so well. And so it can be a protective factor, but it can also be something that accentuates the positive relationship between the two caregivers of the child. So I would say cooperation, prenatal expectations, and social support would be my 3 points here.
Thank you, Marisa. That was very clear. How about Chino? What would you add, or do you find the same issues?
Yeah, thank you. Yes, especially work-family conflict is the biggest aspect among all 3 countries, even though there are big differences of work culture, also social contexts such as gender regime, public services sufficiency, and family policy, and so forth. Parents are struggling facing with this conflict in all 3 countries, and it seems undermining parents' well-being and the right of caring. So it's not the example of well-functioning co-parenting, but this is a critical issue of developing the well-functioning co-parenting. And also, I'd like to add one thing. So at the first wave interview, it means that the prenatal phase, Japan, the participants showed big differences from 2 countries' participants, such as communication way, negotiation style, and so forth, as Daisuke introduced Erin Meyer's the cultural maps revealed. However, from the postpartum interview, Japanese parents seem communicates enough or sometimes well, and getting support from various surrounding support actors. Though I still find some reservedness. However, we found that the beforehand from the first interview, the Japanese style of communication between a couple is, I thought that it might be some problem or problematic issue. However, the second wave interviews showed that it's not a big problem, but the support resources or the working style is more important issue for co-parenting. However, I have to confess one thing. I have to say, only Japan could not get all participants to second wave interview. We lost 1/3 of participants, and they may facing participant who went away may facing difficulties in parenting. So we might only the Japanese data might have some biases.
Thank you, Chino. How about Anna? Would you like to continue?
Well, I think that maybe that kind of team spirit or like a we-ness in the family is also one aspect we have found in all countries, which is very important for the well-functioning co-parenting. And maybe also this learning aspect, that in all countries we have found that co-parenting does not first work well, maybe in the beginning, but after efforts and maybe some mistakes, it can start to work better. And we have found, it was Minna Ranta's dissertation, that among fathers, the learning may happen a little bit later. And but in the end, it can be so that the team works well.
Okay, thank you. Quite a lot things that we have found that are common for all the countries. Marjatta, is there still something to add?
I'm afraid it's been quite the comprehensive views on this, but maybe more or less self-evident is that it's always an event of this particular family. It's a very, as there was a presentation, now I don't remember who was the one, but it's built the co-parenting inside the family, and things happens a lot inside the family, and it seems that this is the kind of experience which is maybe common for all parents, but there are differences how they are approached or helped, and how they are networked in the surrounding society. But maybe that's something which I came to think.
Thank you. And well, let's move to the second theme. And as we have been working together for many years, I think we have learned quite a lot about the other countries also in the projects. And if you think about supporting co-parenting, what would you say that in your country could be learned from the other two countries of the study in terms of supporting co-parenting? Would the Finnish participants like to study, Marjatta or Anna?
Well, I can start now. And there's a lot of information now for me from Portugal, from Japan, and also from Finland. And I think that one thing which paid my attention is that we maybe in Finland should pay more attention to those protective factors, those protective people around the first-time parents. On the basis of this webinar, and also on the basis of the events around in Finland, so it may be so that those families, those co-parents who do not have automatically their relatives and their grandparents and these extended family members around them, they may be left quite alone in the start of this with the new baby. And this is something which I was quite fascinated about, this Japanese way that the mother goes and stays with her mother. This is maybe not exactly the way we could do it in Finland, but I think that we should start to discuss that what other kind of supportive ways we could arrange for the families who are having their first baby. So that is something which I pick up. I don't say that it needs to be the same kind, but something more supportive things, also from the informal network.
Anna, do you want to add something that could be learned in Finland?
Well, I think that this was very well put, what Marjatta said, and this concrete help either from the relatives, but if not near, then from the from the society. Actually, I was yesterday in a big event for family professionals about co-parenting in Finland, and their main message was also that parents need concrete help, not always like information or talking or discussion. Very many parents are exhausted in Finland, so that kind of help would be needed. Yeah.
Thank you. How about Chino? What would you say that what could be learned in Japan?
Yeah, thank you. Yes, as Marjatta and Anna mentioned, that's also me myself found the good relationship with their new parents, mothers, their mothers, and yeah, they get good support from their parents. Yeah, however, I found that I noticed that we should look at the dark side of this Satogairi issue. So yeah, in Japan we can find the intensive support from grandparents, particularly from mothers or mothers. So Japanese mothers enjoy such strong family tie like Satogairi custom. However, this comes from the lack of enough public or institutional support to new parents, and also long working hours culture and persistent gender role division of labor. Also, thanks to the long housewife culture in Japan, Satogairi or grandmother's long stay at new family was possible. But this has include a negative side, as I mentioned. So during that Satogairi time, father might become a bystander, not a co-parent. Sometimes grandmother may be imposing an excessive burden, and there were indeed cases of mothers who mentioned that my mother is suffering the too much burden or something like that. And in Japan nowadays, working mother is more popular, and in the near future, new parents won't be able to expect their parents' support anymore. So in this context, Japan needs more affluent services to new parents. However, we can learn from the Finnish experiences more. Another point that's related to the discourse of family centers and the introvert island. Important point is the child right and children's best. I missed this view which promote co-parenting. I felt it necessary to analyze how consciously parents link the child's interest, how child get goodness from the cooperative relationship of their parents, co-parenting. And we should, it needs more deep consideration, and also there are necessary to make further research. However, that is an important point, I thought. Thank you.
Thank you. And then Marisa.
Yes. So in terms of lessons, it's a very strong word, but in any case, I think that there's always ups and downs in each country, and we think that our countries still need to go much further in several areas. But I would say, and for us, I would say that Finland's generous, I would say, paid parental leave would be something that we could for sure embrace more deeply. It was also one of the things that our parents mentioned, how they lack this time, in these first years, they feel the need to have more time with the babies. And the leave in Portugal, it has some modalities that it can be extended, etc. But to be 100% paid, it goes up to 4 months, which is quite short. It can go to 5 months, but it's only paid at 80%. And so it's reducing further and further. So I would say that parental leave policies could be improved, and also to encourage paternal participation. We have this 1 month for fathers, around 1 month exclusively for fathers, but it's again maybe too short to indeed engage in this cooperation. And if we take into consideration some of the findings that also Sanna was showing about the parental confidence, that for instance fathers get this higher increase when the children is older, so maybe if they get more time with the child, this increase can come earlier on than just waiting for the child to be 18 months. So I would say this, the leave policy to encourage paternal participation would be one thing. There's also much more community-based support, as Marjatta was discussing. Also this community-based support which is being provided, I think it's something that seems to be well functioning in Finland, and we could also learn much more from that. I think that from Japan, and despite Chino's remarks, which I also agree that it can be it can backfire, some of these initiatives to have this intergenerational help. And though we have some intergenerational support very much needed, I will maybe link to the question in the chat that someone is asking about. Indeed, I think that we need to embrace much more the view that it takes a community to raise a child. And so if not the grandparents, we need to embrace much more the community in raising a child. I strongly believe on that. But I think it's very hard when the work cultures don't work, but when the work culture doesn't become flexible. And in that sense, I believe all the 3 countries are somehow limited. So in all the 3 countries, despite some changes, there's still a very much reference to the work sphere, to the intensity of this role. So this was something that all the 3 countries could learn, or at least try to change. I hope I was clear. Thank you, Kaisa.
Thank you. And we still have time for the 3rd theme. And let's now talk about the low fertility and intentions to have another child, as we have heard some presentations today related to this issue. What do you think? How family life or co-parenting should be supported so that families would see having a second child as a possible or plausible option for them? And would you, Marisa, like to start? Would you say some of the same things that we have heard already, or is there something else to add?
Yeah, so it's indeed, I think that what can help co-parenting what can help establishing a co-parenting relationship can also help parents decide on having a second child. So indeed, some of the aspects can be repetitive somehow. So the workplace initiatives and the leaves, but maybe I will also focus here on the prenatal aspect. That was also our background for this study, and I believe that if we direct these family support interventions not just when the child is born and to the parenting, but also from the pregnancy stage, and we recognize how the expectations of co-parenting are being developed, maybe we could facilitate. So if the parents perceive that they are already being supported beforehand, before the child is born, maybe this knowing that this will be available can help them decide in a better way. Another aspect, very specifically, just to mention, is that I think I didn't mention before, has to do with the campaigns. And I think that public campaigns that make visible role models that can shape fatherhood, that can shape these more shared perspectives among the couple, that can show how this can be easier. Because I believe many couples feel the demands of their work, the demands of their social and financial situation, of and I believe we should also bring nowadays also how the world is is being quite scary at the moment, with a lot of wars popping all over. So of course this brings a lot of anxiety. So these people need reassurance to make this decision, to feel that they will be supported. And I also think that public campaigns and role models could help them engage better in this difficult, or at least challenging decision.
Thank you, Marisa. Chino, what would you add?
Thank you very much. Yeah, it's not so much to add. However, that's today's two presentations, Sanna's and also Marisa's. Those presentations revealed good implications very much. And so I think that mitigating the work-family conflict and sufficient support for new parents are key to having second child, and enable parents more independent and promote their well-being. And I also think about that it is very important to think about consider about how the new parents decide having another child. So I mean that the new promote new parents or young promote young generation to find partner and have a new baby is very difficult thing. However, that having another child and promote that is a kind of realistic way to considering low fertility rate and its measurement. So that's today's two presentations are very implicative for us. Thank you. And also I found that some comments and questions from audience that how about to think about to getting support from community or neighborhood areas. And in Japan, during 1970s and 80s or 90s, one researcher found that there are affluent support from neighborhood areas and also community, mainly from other mothers or female actors. However, the development of community or development of further development of society made these kinds of relationship difficult, and nowadays the new parents or young generation rely on more and more their blood tie. So they ask only for their mothers or fathers or relatives, not to ask help from neighborhood areas and the communities. So that's there are some room to think about this kind of issue things. Thank you.
Thank you, Chino. And we still have time for short comments from Anna, and then Marjatta, what would you add in the end?
I would add more appraisal and respect to parenthood and children in the society, more positive atmosphere. I was thinking that should we have time to the chat questions? There are some chat questions before.
Yeah, I'm not able to see the chat questions, but if Marjatta, do you want to add something, or in the meanwhile, if you can read the questions, you may say some of them aloud and add your answers.
We go on the same line with Anna. I was thinking exactly the same thing.
Nice.
More confidence. We should change our way of talking about parenthood. And I think that we are, sorry to say, but maybe we are also part of the problem, because we are so skillful to bring up the critical sides of things, but we should be able to bring up those positive things with gifts confidential to parents. So appraisal talk, emotional talk also.
I'm reading from the chat that somebody is saying that it's important not only focus on the informal support or on formal support, rather like to talk about the balance between them, and they are both like important. So and depending on the needs of the family, and I totally agree. And then there is somebody saying that it's fun to watch the daily changes that come with having a baby. Maybe it's time to reconsider what happiness is. Yeah, maybe like understanding that in the middle of the family chaos and things like that, it can be also fun, and it can be also a source of happiness. And there is somebody talking about the job market and also the need of the community. But I think that we have discussed already those.
So I would like to thank you, all the panelists, and Nina, maybe you have something to say in the end also.
I would like to thank all of you presenters. I think this was a wonderful example of how when researchers from different countries, different sides of the world come together and work together with the same theme, and how much we all can learn from topics that are come very near to us. And I think it's fascinating to hear perspective from different countries. And I was also very happy to see audience from different sides of the world listening to this. So I really truly want to thank you for sharing your expertise. And
thank you, Nina, for arranging this event, and also other people who are involved in your in the Finnish Institute in Japan, and also the Portuguese Institute. So thank you for all of you.
Can I say one thing a little bit? I'm very sorry. Let me say in Japanese to Japanese audience. So the content is that we are recruiting researchers who join this co-parenting research. So 日本の皆さんでもしコーペアレンティング研究に興味がおありの方はぜひご連絡をいただければと思います。Thank you.
So I understand that your work is still continuing. You are analyzing the previous data and also perhaps collecting new data related to this topic. So we will perhaps hear from your work in the future as well. So thank you so much. Hope to see you in the future.
Thank you all.
Thank you very much. Yeah. Bye-bye. Thank you.
Bye-bye.
Thank you so much. Bye.